Hi, my name's Elise Whalen. I'm a nurse practitioner at Texas Children's Hospital. I'm also an assistant professor at Baylor College of Medicine. We're happy if you tell us there's a problem rather than us finding out later or discovering there's a problem later. And so, generally, if you're ever hesitating or if you ever do have questions, we'd rather you ask. And I think there's a lot of better access to care now than there may have been with things where you're able to, message the provider's team directly, things through like my chart or other patient access mechanisms. And so, for instance, let's say you're at home and you notice that your child may be having severe or worsening symptoms. Maybe they have bleeding. We had a recent instance where there was a sub-Q site that was just bleeding. That was like abnormal for that patient, right? And I think that would be an indication where you would seek additional help. Other things would be new. So that kind of goes back, new symptoms. So that kind of goes back to the previous thing where something's just not right. This sub-Q site is now bleeding, or I have this new rash, or something's just off. Allergic reactions, if you're ever thinking that there may be concern for an allergic reaction, and that can manifest in a lot of different ways, it's usually best to tell your team because I think they can help you determine if it's a true allergic reaction or maybe some kind of intolerance rather than just labeling it as an allergic reaction and then limiting your ability to maybe get that medication in the future. It's usually good to let us know right away that there may be concern for that. I mentioned that there's medicines that cause fluid retention. And so that's something that we look out for. But when you're at home, telling us, hey, you know what, I've noticed some more swelling, or I've noticed that I've had some more weight gain and I'm not really changing, my diet that much. Those are some good things to let us know about. Liver function changes. So, obviously, if you're on medicines where we're happy to monitor your liver monthly, we'll know about liver function changes, but, there may be some subtle signs, maybe some more nausea, more GI side effects that we may be seeing, or stool changes, things like that, where we need to probably know about that sooner rather than later. And then bleeding, so unplanned bleeding, bruising. Some of our patients may be on medicines that could cause more bleeding, and so we want to know if if you're more prone to bruising, or if you're having areas where you're like, "Ew, my gums are more or are bleeding a little bit more when I brush my teeth," things like that. Mental health concerns. So this is a big passion of mine. I think that mental health can have a big impact on adherence in your ability to continue to take medicines multiple times a day. And so if you're noticing that there's some changes to that, or you feel like, you know what, my child has lost interest, he's not letting me help him with his sub-Q site as he used to, or he's not letting me look at the rate that it's running at, or something like that, where that can be a big deal if they somehow manipulate something with the rate, or, that's something that we need to know about, or you need to notify us about. And then lastly, medication adherence issues. And what that means is, your teenager is trying to become more independent, trying to take their medications more often, and there's just some concerns with them taking a certain dose, or maybe they're on a medicine where they're having to inhale it, and it's 4 times a day. That can be a big concern. And so we want to know about medication adherence issues, because if there's just a problem with your ability to keep through with the number of times you're supposed to take a medicine, and we might be able to change it to make it a little bit easier for you. I think the biggest thing is making sure that you are partnering with your team to kind of create a really nice individualized care plan. Thinking about, I have to take this inhaled medication 4 times a day. How am I going to do that with school? Talk to your team about that, because we can say you need to do X, Y, and Z, but at the end of the day, if you're not going to be able to do that, then that doesn't sound like a great plan, right? Other things are looking at risk and benefit. So you may need this therapy, but if this therapy means that you're going to have really, really bad nausea or really, really bad headaches, then we may need to adjust the dosing for that. And there's things that we can do to lower some of the side effects. Other things are regular monitoring. I had mentioned a little bit about access to care and having, maybe a greater ability to maybe talk to your healthcare team a little more readily. And so I think that there are pretty good monitoring protocols, and with the help of the multidisciplinary team. And what that is a lot of PH centers may have a dietitian on their team. They may have a social worker, a nurse practitioner, or a physician assistant, a physician. Or a pharmacist. a wealth of knowledge on these teams, and we're all here to help you and partner with us so we can all together create a plan that will be best for your child.